Part of the nursing department orientation is for the new staffs, trainees, and nursing interns to know how to manage their time and the stressful work in the nursing units. Stress management is defined as a set of techniques and programs intended to help people deal more effectively with stress in their lives by analyzing the specific stressors and taking positive actions to minimize their effects. In life, something I learned the hard way, especially at work, is how difficult to enjoy and relax when you don't have the time itself. But what if we don't listen to our body? If we continue slowly burning the candle at both ends until we reach physical and emotional exhaustion? Just like the candle itself, we burn out. And like the parable of the frog who finds himself in a pot of water on the stove. When the water starts boiling, he doesn't notice the slight increase in temperature as he swims around busily, until the water reaches unbearable degrees, and without the frog realizing it, he can no longer survive. Have you ever experienced this slow acceptance of the pressures building around you until everything gets too much and you can no longer cope? The World Labor Report, produced by the UN's International Organization, states, stress has become one of the most serious health issues of the 20th century and a worldwide epidemic. Let's change the way we approach our management of stress this year with these tips and techniques to keep you swimming peacefully over the coming months. So what is stress? Stress is the psychological, physiological and behavioral response by an individual when they perceive a lack of equilibrium between the demands placed upon them and their ability to meet those demands, which, over a period of time, leads to ill health. The following are the symptoms of stress: difficulty sleeping, weight gain or loss, stomach pain, irritability, headache, difficulty concentrating, heartburn, social isolation, fatigue. Why is stress helpful? It acted as a protective mechanism that warned us of danger, a natural reaction telling us when to run. It is believed that stress has remained part of the evolutionary drive because of its usefulness in helping us to survive. This response is now referred to as the fight or flight response, or the stress response. Since when it's used at the right time, stress temporarily increases our awareness and improves physical performance. Why is stress harmful? Repetitive exposure of the stress response on our body is proven to lead to long-lasting psychological and physical health issues, such as cardiovascular disease, diabetes, anxiety, and depression. Stress versus burnout. Stress is inevitable. Burnout is not. While stress is our response, burnout is the accumulation of excessive stressors over time, which results in unmanageable stress levels. The following are the 7 tips for stress management. Understand your stress. Identify your stress sources. Learn to recognize stress signals. Recognize your stress strategies. Implement healthy stress management strategies. Make self-care a priority. And ask for support when needed. The following are the 13 different stress management techniques and strategies. Be assertive. Reduce the noise. Manage your time. Creating boundaries. Get out of your head. Affirmations and imagery. Practice cognitive restructuring and the ABC technique. Have a proper diet and exercise. Practice meditation and physical relaxation. Build resilience. Talk it out. Have enough sleep. Aside from learning how to manage stress, all the new staffs, trainees, and nursing interns need to learn how to manage their time in the nursing units. in order to finish all their work on time or meet the deadlines. What are the time management tips that every nurse should know? Everyone in the healthcare team should understand that a nurse's job is not as easy as what most people think. In addition to administering medications, assisting patients during ambulation, and performing routine assessments and procedures within their shift, they also have to finish the chores they left at home and attend to their family's needs. With all the things they have to do, it's easy to feel burnt out. The following are the time management tips every nurse should know. Arrive early. An 8 to 12 hours work shift can sound too long for other people in regular jobs. But for nurses, however, it may still not be enough, especially with the number of patients you have to handle, and all the accompanying tasks that needs to be done. To make sure you don't get home later than you're supposed to, because of these tasks, try to arrive 20 to 30 minutes earlier than your shift. You can use this time to go over your patient's charts and prepare your plan of care. The next time management tips every nurse should know is to set priorities. Once you have an idea of what needs to be done, it's time to set your priorities. Prioritization is a must-have skill for every nurse, and it's also one of the most challenging skills to master. When setting your priorities, find out the most urgent and important tasks. Several medical conditions vary in complexity, so make sure you do your assessment properly. Another time management tips every nurse should know is to estimate how long it will take to finish a task. A nurse should also have an idea of how much time you need to spend per task. One of the most common reasons nurses fail to complete everything they have to do in a single shift is the overconfidence in their ability. There will be doctors making their rounds, patients hitting their call bells, and relatives making inquiries. Be sure to set up some allowance in between tasks to accommodate them. Next is to avoid tasks that are not in your list. Sending emails and text messages and chatting with your colleagues can take up a lot of your time, even if you only thought to do it for 5 minutes. Don't fall prey to this type of reasoning, and remain focused on your list. Unless your patient's well-being and safety demand it. Another is to learn to say no. Nurses are their patients' primary caregivers. If a patient comes up to you with a non-urgent request, learn how to politely decline for the moment, and offer to see him later after you're done with your urgent tasks. This goes the same for colleagues asking for help. Part of the time management tips every nurse should know is to learn how to listen. Having a busy shift can make it easy for you to oversee things. As much as possible, don't assume that every patient who will be reaching out to you will have a petty request. Their priorities can differ from yours, so make sure you still pay attention to what they have to say. Another tip is to take a break. Even if you don't think you need a break, take one. Your body and mind still need to take a breather, especially with how hospital work can be stressful. Take the time to collect your thoughts, drink water, and take a bathroom break if needed. No flexibility. If you work in the ward, you will know how unpredictable the setup can be. Because of this environment, you need to know how to refresh your priorities once in a while, especially if there will be newly admitted patients that need urgent attention and care. Be organized. Don't let papers pile up at your table, and avoid letting equipment lie around when not in use. Keeping your workspace organized and clutter-free can help you stay productive throughout your shift. It can also help avoid work hazards. Keep notes. You can simply create a to-do list and tick each box as you accomplish it. Keep the notebook easily accessible, like inside your uniform's pocket. Don't take things too hard. Time management is a skill that can't be learned overnight. If you fail at your first attempt, don't feel too stressed about it. There is always the next day to hone your time management skills even more. Thank you for participating in this lecture for stress and time management. In a very stressful environment of staffs in the nursing units, the greatest weapon against stress is our ability to choose one thought over another. And time management requires self-discipline, self-mastery, and self-control more than anything else to cope effectively and to avoid being burnt out.